from the Calvert County Health Department. Doctor, the floor is yours.
Thanks, Adina. I have been getting at least 2 hours of sleep every night. And I'll digress for a second. It is really important. Everybody out there has been stressed in lots of different ways. It is really important that we take care of ourselves. And so I've set a hard cutoff of not working past 10 p.m. And then I'm up at whatever 5. But I've not, at least I'm making sure I'm getting at least 7 hours of sleep every night and making sure that I'm eating well as well. So I encourage all of you to make sure you're taking care of yourselves, taking care of your families as we go through all this. It is not lost on anyone at the health department that there are a lot of people out there who are financially struggling and suffering along with that. And it's business owners, it's employees. It is part of our mission to make sure that we help you get back to business as quickly and as fully as we can. I'm sure that you all realize that none of us have complete control over what is going on, and we will not have complete control over what will happen probably through the next at least 6 to 12 months. Hopefully we see a vaccine sometime into early 2021, but at least until then, it is not going to be business as usual. And it's a question of how much you can all do to get your businesses as back to normal and employ as many people as possible. So I will start by saying that my environmental health staff, Matt Cummers, Jessica Williams, and Brooke Hebb, spent a lot of time last week developing one-page guidelines for different business sectors, in addition to guidelines for employee screening if they should potentially be infected. I was told yesterday by state level that I was not allowed to distribute those, which is frustrating for us. On a local level, we want to be able to educate as much as possible. The rationale that I was given is that there have been and continue to be discussions at state level through the Department of Commerce involving all the different business sectors, and they want as much as possible to have uniform guidelines throughout the state, which is great. The downside locally is that I wanted to be able to share all those with all of you prior to this meeting so that you could take a look through, offer us comments so that we could revise and help you better. So I'm going to go through some of the things that were on those sheets, but unfortunately, again, I was told that I could not distribute it prior to the meeting. I'm hoping that before this week is out, we'll either have approval from state level, or from state level, they will have their own documents that we can share with all of you. So just a few basics. And I think for a lot of this, you've been through enough in the past 2-3 months, although it feels like 2 or 3 years at least, that you know what I'm about to say, but it doesn't hurt to put it into a little bit of context. And then there will be some specific questions, I'm sure, for different industry sectors. So I think the first thing is that for businesses that can continue to have people working from home or remotely in any way, they should continue to do that as much as possible. Obviously, there are businesses where that's not feasible. And there are businesses where part of your staff has to be on site and part of your staff can work remotely. The people who do the accounting, all the finance stuff potentially can work from home. The people who are doing direct customer contact obviously have to be on site, or at least in many cases have to be on site. Some of you may have developed techniques where you can interact with customers remotely like we're doing right now, in which case we would encourage you to continue doing that. And you need to consider the trade-offs, that it might be slightly better, or that's just the way we've always done it, to meet in person, but you never know when your employee may end up getting infected as a result, and you may lose that staff member for a week, for 2 weeks while they're recovering. And if that staff member gets sick, and especially if it's a mild illness, they could transmit it to other staff, and you could lose half your workforce a week or two down the road. So I think it's important all the way through to balance your short-term trade-offs, which is what can I do that day in my business, for what the consequences may be a couple weeks down the road if you end up with mass illness. Secondly is that when you do open up, I'm sure all of you have heard the 6 feet of separation. That's a minimum. And so I would encourage you, if you have an instance where you're having half of your staff working from home, that people don't have to be at the desks they normally work at, you can reconfigure so that people might have 10, 12 feet of distance. The more distance between, the less potential that virus particles can be traveling back and forth between people and getting people infected. What we've done at the health department for our environmental health staff, for our infectious disease nurses, people who really need to be here, is we've been working staggered shifts. So half of that division is working remotely that week, and the other half is on site. So we can space people more, and we continue to cohort. So the people that are there week 1, they're all gone week 2. The people that work week 2, they stay together, so that at most, if someone gets infected through their normal, when they're going wherever, that at most, they're only going to potentially transmit that to half of the workforce, so we still have the other half who can function if we end up in emergency situations where we need. So it's not just how many people are on site, but consider who they're coming in contact. So for businesses that have multiple shifts a day, you want to minimize people switching shifts and potentially infecting people on the day shift and the evening shift. Keep them just on day shift, keep them just on evening shift if possible. It's important, and I'm sure that you're all aware that increased cleaning is going to be necessary, but that means that 2 things. 1, you need the cleaning products. So if you haven't already started to accumulate a bit more of an inventory, your products are going to last you much less period of time, because you're going to be cleaning instead of once a day. You may be cleaning every 2 hours, or maybe even more frequently, depending on what your business is and how many members of the public are coming in. And even in back rooms, like common kitchen areas, you're going to want to designate. So the second is you're going to want to designate specific employees who are responsible for doing that cleaning. So whether it's high contact areas from the public, whether it's your break room where the coffee machine is or where the sink is, that at least every 2 hours, if not a bit more frequently, that with an EPA designated disinfectant, which is almost everything that is a name brand, and probably everything that are store brands, that you're going to do frequent cleanings with that. Particularly important, I know there was a question that popped up, what about shoe stores? So, I wouldn't say there's, for the most part, nothing special, and I'm not making a comment about shoe stores, but there's nothing special about any type of small business that don't have commonalities other places. But I can see, and shoe stores share with others, that you have customers who are picking up a lot of objects. They'll pick up a pair of shoes, they might try them on, decide they don't like them, they put them back down, or they just pick them up, they look at them, and then the next customer is going to pick that shoe up. So regardless of the type of retailer, if you have inventory that customers are going to pick up as they decide whether they're going to make a purchase or not, what's really important in that case is to have hand sanitizer available the moment that customers walk into the store. And again, that's, when you think about cleaning products, for most of you, you've probably never had hand sanitizer as part of your normal business inventory. So those are things to think about. It's also hand sanitizer to some degree has been in short supply. So you may want to look at unconventional places to order. Some of the distilleries around the state have been switched over their manufacturing to include that. The other option would be, and this is particularly for employees, probably not as feasible for customers, which would be to make sure there's plenty of hand soap so that people can wash their hands. I will say that in general, and this particularly for your employees who are valuable in that you're not going to open up your business if you don't have staff, that hand washing is preferable to hand sanitizers. So my recommendation would be that every employee, regardless of the kind of business, the moment they walk in, the first thing they should do, because you don't know what they've been touching on their way in, they should just, their first step should be to go over to the bathroom or go over to any kind of sink, wash their hands thoroughly before they start their day. Masks, something that I'm sure we've all become more than acquainted with at this point. So both for staff and for customers. Exceptions would certainly be for staff who work isolated in their own office. If you have staff in cubicles, but cubicles by their nature are clustered, people should still be wearing a mask if they're sitting at their desk and they're sharing a space with other people. The governor's guideline at this point is no more than 10 people in a common space. And I know that we had a business owner who contacted us yesterday who owns a fitness center. He wants to do outdoor fitness sessions, which are allowed now by the governor's orders. So that's fine. There's less potential for transmission when you're outdoors. The virus particles disperse more, but it's not a zero risk. So if you have people who are still very close together outdoors, they still potentially can transmit. So in that setting, the class size would be no more than 10. And you have to keep in mind that includes staff. That's not just the customers or their participants. So if you have 2 staff people there, then you're limited to 8 customers in addition. And what, other thing I want to emphasize before we give time to other people is that, how do you screen your employees? So one of the handouts that we have that we'll be happy to distribute as soon as we get the okay from the state is, I don't expect any of you to be nurses or doctors, but there are basics that any employer can do as far as screening and educating their employees. So basics, which again, you should all be familiar with at this point: cough, shortness of breath, fevers and chills, and sometimes people just have chills and no fever, diffuse muscle aches, sore throat, and one symptom that showed up in about a quarter of people is a loss of taste or smell. And we've identified quite a few people in the county who were contacts of someone who had tested positive. We, as part of what we do at the health department, we've been contacting everyone who is put at potential risk of transmission from that person who tested positive. And it's not infrequent where we're making phone calls and we're hearing from somebody, oh, I feel fine, but 3 days ago, I can't smell anything anymore. Invariably, those people have tested positive when we've had them tested. So what is, I think, really a critical thing is educating your staff. When we're able to disperse this information, I would either make physical copies or preferably, if you can distribute online through email chains with your employees, to send out information to them. And what is most important is not waiting for them to come in for their shift and saying, oh, I've really been feeling crummy for the last 12 hours. That the first sign that they have that they may not be feeling right, they would call their supervisor and let them know before they present in. And that may sound obvious, but that's not what typically happens. I think we've all done it ourselves, and we've all certainly seen employees who show up at work, I can get through the day kind of attitude. And the reality for this virus in particular, given how transmissible it is that they are very likely to then infect several of their coworkers. So the message really needs to be loud and clear that the first sign that somebody has that they may be coming down with an illness, they need to call their supervisor and they need to stay home, and then preferably they get tested. So we have a drive-through test center, if you weren't aware, in Prince Frederick at the vehicle emission station. We have capacity at this point to test 160 people a week. And if we have more demand, we can increase that capacity. So all that anyone has to do is contact their doctor or nurse practitioner, say, I'm feeling crummy, I think I might have coronavirus. Their doctor or nurse will then go into a computer database. They enter in the information, and then that person can register an appointment slot and just come in and get tested. The test results have only been taking about 48 hours to get back, so they're not out of work for a week or 10 days waiting. And then if they have the virus, obviously we want to know that because we want to minimize them spreading to not just your employees, but to anyone. And if they don't have the virus, if they just maybe have a little bit of a cold or something, that's great, and everybody knows, and they don't need to be out of work for 10 or 14 days. So I'm going to wrap it up there for the moment, and I will be on the call for the rest, so I'll be happy to take further questions as we go along. Thank you very much.
I think what I'm going to do now is I'm going to actually do a poll real quick, so Dr. Polsky can see what type of business industries that we have. So I'm going to allow everybody to vote. So if you could just take a second and just click what industry you're from, we would greatly appreciate it, so we can get some idea of who's here. And our panelists can vote as well. So if our panelists can see the screen and they want to vote, I'm going to leave it open for a couple more seconds. And then Dr. Polsky, we do have some questions, and I'm just going to read them out to you. Would any type of eye covering, glasses, or some sort of goggles be advisable? Dr. Polsky, you're muted.
I'm unmuted now.
Thank you.
So for the average person, just in a typical business, they really don't need eye covering. The chances of them contracting the virus in that way would be really, really small. In certain medical settings where there's things being aerosolized by procedures, we definitely recommend. So I would say that for people who want to take every precaution, it's certainly fine for them to put on some goggles. But as far as necessary, no. For your staff, no, you don't need it. For businesses that's important, we will make sure through the health department we reach out to those specific businesses and let them know and which specific types of job classifications that's important for.
Thank you. And then another question is that the businesses can't seem to get proper cleaning products. She said, how can we help with getting bleach, proper disinfectant, paper towels, and hand sanitizer, and proper bathroom soaps for highly used bathrooms and masks for staff? So I guess PPE.
Yeah, so that's a statewide and really a nationwide problem. And that is part of the considerations that are going into the pace at which businesses open. Can they get just basic products to be able to minimize the potential for disease transmission? So there isn't a local solution. If there was, that same solution would be everywhere. We wouldn't have these problems. That's what's going to come out of state level, is how do they prioritize to make sure that the businesses can get the cleaning implements that they need, and that includes PPE as well as disinfectant to be able to open. So again, that's to come, to be determined.
Another question is, if they have an employee that tests positive, should businesses close for a recommended period of time to disinfect?
What we have been doing at the health department is that when we have somebody test positive, we talk to that individual first. We let them know that we would then like to go ahead and speak to their supervisor at work so that we can give advice. And to this point, we have not had anyone say, no, you can't contact my employer, my supervisor. If it's a critical business, then as a public health entity, we don't technically need permission, but we've been trying to make sure that people understand. So what we have done to this point, and what we will continue to do, is that we will then reach out to the supervisor, find out who among the employees were working similar shifts. We know in almost all cases when that person was infected, so we can then look back. It's generally 48 hours prior to onset of symptoms. So what we're looking at in that case, we have the manager pull up who was working on the same shift for those 2 days prior. Sometimes we get lucky and that person hadn't been working for a few days. And then those people either are held out in isolation, or we go ahead and test depending on the circumstances for the individual. But in general, we don't have to shut the entire business down. We would recommend
Looks like
additional cleaning as a business. So that's one of those that we would be able to give very detailed information to that particular business owner or business manager if and when the time came for their business.
Okay, I'm going to ask you one more question, and I'm going to take it over to our panelists to give you a break for a second. Somebody wants to know, do we have the ability to test for prior exposure antibodies? And if so, what is the guidance? Okay, it looks like Dr. Polsky is frozen for a second, so I'm going to go over to our panelists, and I'm going to start with Ben. And I'm going to ask, what have you done to keep your customers and employees safe in the recent weeks, and what have you learned? If you can just share. And then after Ben, we'll go to Jeff, and then we'll go to Todd.
I'll hit on real quick on the cleaning supplies, as we do sell that kind of stuff. They are very hard to come by. We are doing our best to try to get our customers cleaning supplies, but also, you know, I've worked with a lot of small businesses in the area, the county, the hospital, to try to get them what they need for this virus. Our priority going into this was first our employees and then our customers when all this started taking place. And we've implemented a lot. I will say up front, you're not going to please everyone. As we all know, as business owners, you're just not going to please everyone. And what you're doing is not going to be up to the standards that anyone wants. But we do feel what we've been doing is to the top to try to keep everyone safe and clean. We looked at touch points. You know, we clean throughout the day. We disinfect in the morning, we disinfect when we close at night. We've shortened our hours. We've shortened our days of the week that we're open. We've split our team up into 2 shifts at both stores, no cross contamination. Therefore, me as a district manager, I can't see 3/4 of my staff right now. Just a lot of stuff Dr. Polsky was going over. We discontinued a lot of services right now. I should say we suspended a lot of services that would increase bringing things into the store, and as well as our staff being exposed. We're practicing social distancing like crazy, and we are limiting the amount of people in the store. Obviously the masks coming out, all of our staff wear masks. Anyone coming in the store has to wear the masks. There are a lot of people that are going to press that issue. There's a lot of people that are just going to press a lot of issues with your business. But other than that, we are trying to take everything serious. Every touch point at the register, our cashiers are trying to clean to keep our customers safe. And we were just trying to keep encouraging people to wash your hands, as you said. You come in the morning, we do ask the questions. If someone calls and they're calling out for the day, we ask the 3 questions that they've, kind of HR has given us permission to ask our staff if they do feel like they have the virus. We've had some people that have gotten tested, and luckily, and thank God, we have not had anyone that have had it so far.
Thanks, Jeff. I also noticed that, or Ben, I'm sorry, that you're disinfecting carts as well when people come out of the stores, and you're also eliminating people in the stores. Has that been something that has worked well for you?
Yeah, the carts, we determined early we weren't going to be able to get enough wipes to be able to offer everyone as they come in the door. So we found some cleaning solution, disinfectant that we spray. We let sit on the carts for 5 minutes and then wipe them down and put them inside. So there's fresh carts for every customer coming in. The limit on the customer, that has been one of the biggest challenges. And of course, I will say, as a business owner, it has tremendously affected the business, but that is something we were committed to, that we are, we're not really wanting to chase business right now. We're wanting to keep people safe. But that has been a challenge for a lot of customers. They don't like it, but that's something we're standing to. We were at 10, and as Governor Hogan has, kind of lifted some of the regulations, some of our shifts are operating anywhere from 15 to 25 in the store, because we looked at the space in our stores, and I believe the guideline was 5 for every 100 square feet, and we can technically allow up to 100, but we're not pushing that for the safety of and honestly, the mentality and health of our staff. We don't want them being overwhelmed. On a normal spring day, we can handle 70, 80 people in our stores, but the mentality with the virus going around, our staff gets a little more worried with that.
And before I let you go, I actually have a question that I think maybe you could be the best person to answer. Have you had somebody that has come into the store without a mask, and what do you do in that circumstance?
Yeah, we've had quite a few. Some people want to put their shirt over their face, and we've kind of nixed that just because we know they're not going to keep it up. Most people don't. They get down the aisle, they drop it. We bought they weren't really cheap. The cheapest we could find to allow customers that don't have a mask to come in. So we do have some customers pushing back that they have health-related issues that do not allow them to wear masks. I know we don't know. We're putting out the feelers to our HR world whether we're allowed to inquire, force them to provide some kind of proof, because ultimately the safety of every staff member in the building is our priority. So we do have people trying to buck that, and I know that maybe they do have a health problem, but are they just trying to get around not wearing a mask? And that's the fine line of pressing people to cohere, to what we're trying to do. And it's been tough. I will say that.
Actually, Dr. Polsky, maybe that's actually, if I've heard this question several times, Dr. Polsky, what is your take on the fact that if customers come into stores and they don't have a mask, what should the business owner do?
First off, I apologize. My internet connection dropped a few minutes ago. there are very few people who truly can't wear a mask for health reasons, and almost always those are people who are oxygen dependent. So if somebody doesn't have an oxygen cart they're wheeling behind them, they can put a t-shirt or something over their face, and not, as Ben mentioned, not to pull up their t-shirt, but have something properly fitted. It's important to keep in mind it should cover both nose and mouth. You see a lot of people who just have over their mouth and they're exhaling through their nose. The importance for every business owner, business manager out there is that masks are protecting your staff. And so it's not about protecting the customer, it's about protecting your staff. And so you, as far as I know, and I'm not a lawyer, I'm not going to pretend to be, but you have a right, it's a private business. You have a right to decide who can come in. And we have lots of other standards, people can't, some businesses, the no shirt, no shoes, no service kind of thing. Certainly you can deny if you have reason to think that they should be able to wear a mask and they don't. So yeah, by all means, stand firm. The health of your staff and their family members are at stake. And the reality, I was in private business most of my life. I'm relatively new to government. There are occasional people that, if you lose them as customers, you lose them as customers. But they're not necessarily in your best interest if they're going to act in the way that they're trying to. Also, I just want to touch on one thing that Ben mentioned. So when it comes to cleaning carts, and he's right that for a lot of businesses, they just don't have individual wipes. They've been using sprays and bottles. If depending on how many carts you have, potentially the containers, you see people spraying for weed repellents. You can fill those up, pump it up, and then just go ahead and spray, dozens of carts at a time. And as Ben mentioned, ideally you want to leave the disinfectant in contact on the cart handles and other surfaces for at least a few minutes. So 5 minutes is a good rule. And then just a quick wipe off would be fine. So I applaud you for taking that step.
Thank you, Dr.
I will hit on that again. We were worried about how much we would have to clean, so we actually decided to make the decision to remove all our baskets as well, just because the amount of cleaning that would require us to do, and we operate around, I think, 10 to 20 carts when normally we'd have 30, 40, just to kind of decrease the touch points a little bit to allow our staff to clean properly throughout the day. So that's something we get into. But on the mask as well, our managers know that's important. If they're seeing someone walking around with their nose out, we ask them to pull it up. It's not always received well, but as you said, and I don't want to offend anyone. Our employees are our utmost priority. Customers, of course, but we want to take care of our staff. And if we do lose a customer, at the end of the day, it's okay. We just want to protect our staff and their family.
Thanks, Ben. So Jeff, I'm going to go to you real quick and ask you, what guidelines and directions are you compiling for the professional service sector to ensure safety for customers and employees? If you don't mind, Jeff.
Yeah. So one thing I want to do is I want to amplify what Ben said, and that is everything that we're doing is about our employees first and then our customers, because without our employees, we don't have customers. In doing that, we have almost 1,900 stores across the country, and I've been pulled into handling with all the stores, dealing with all the different state guidelines everywhere. There's so many different states that are coming up with different guidelines where we've had to kind of prepare across the board. Every one of our stations normally, would have hand sanitizer. If anybody that's a hairstylist, a barbershop, or nail salon on this call, we all know that we're probably one of the most sanitary environments that's out there, other than a hospital. One of the classes that they learn about is infectious control inside their training to become a barber or hairstylist. So in doing that, we're changing some of our processes and procedures when it comes to how we're handling our clients, some of the touch points. We provide a service called the MVP, and we have to be concerned about how that's handled with a hot steam towel, even though the temperature that those towels are on are higher than the standard of where they say the virus would even survive. We're adding certain things inside of our stores to make sure that we're maintaining social distancing. We are shifting our stations so we can actually, on a regular basis with no concern, even rotate stations. If most of our stores have 8 8 chairs. We're going to be probably rotating between 2 for one stylist, giving that time for that one chair to actually, when we've gone to sanitize, let the chemicals soak in and actually stay as to the CDC guidelines are. One of the things that Dr. Polsky was talking about was, not really being able to share some of the guidelines. 2 weeks ago, I was called in by the state of Maryland and provide guidance of what we are doing with sport clips as far as the hair industry. One of the key things that I will tell you is going to be signage. You have to communicate with your customer what your new policies are, what your new procedures are. For example, hair salons are probably going to go to an appointment basis only or an online check-in aspect because you're not going to be able to have your lobbies full of people. That's going to really affect social distancing. Hand sanitizer is going to have to be available. I've seen some businesses in different areas that have closed down their restroom. Me personally, I think it's crazy because there's a hand wash station. If a customer, you need to ask the customer to wash their hands. We all know wash your hands is probably one of the biggest things with this. So in doing that, we're going with a lot of different guidelines. We actually resourced a local janitorial supply company out of Southern Maryland to actually put hand sanitizer pump stations in all of our stores that are available to clients and to our staff, not just this hand sanitizer that's at the stations. We've also invested that every single client moving forward will have a fresh cape instead of reusing a cape. And that's more because of the contact points. Our check-in system that where somebody would use a tablet, we've invested in the touch pins and things like that so people don't have to touch with their fingers. We've invested in all the chemicals that you can have to disinfect, even though inside of any barbershop hair salon, we probably have the best disinfectant anyways. It's called Barbicide, and mixed properly, it's hospital grade. So inside our environment, I think we're going to be very safe. The unfortunate part right now is I have 23 locations and all of them are closed. I have employees that are home that want to go back to work. We're working to build confidence in our employees. The state of Maryland did come up with a guideline where we could have done a one-on-one where you could have one person in the building with one customer. But I didn't feel it was a safe environment to ask a young person to be in the building with somebody they didn't know and lock the door behind them. So we've decided to wait it out. And I think most hair salons and barbershops have decided to do that, and also waiting for better guidance or guidelines. I know that it's being pushed at the state level as far as for the hair salons and barbershops and nail salons to kind of look more at a square footage aspect rather than just a dead 10 people in a building, because we have to worry about if a mom comes in with a child to get a haircut, she counts as a person in the building, and that could actually shut you down with an opportunity of a chair to keep your flow going. We right now as a company, as of this morning, there's out of 1,870 stores across the country, we're back up. We went all the way down to zero stores open, and we're back up to 600 some across the country. None of mine are open yet. Hopefully, Governor Hogan will give us some guidance here this week that'll allow us a direction that we can take. We're spending time in every one of our stores to disinfect everything, clean everything, make sure all the supplies are there. I will stress one thing that Dr. Polsky did say, and that is about finding the supplies. Sneed's in Calvert is a great opportunity to find some of the items that you may need. But when you're looking for masks and you're looking for, if you're a hair salon, you're going to need the extra capes or you're going to need certain sanitary things. Don't wait until we get the notice to open. Start getting it now. You have to. All right. If just as a little reference, if in the retail stores in the county, if you can't find some of the disinfectant type items, research in Southern Maryland for restaurant and janitorial supply companies. There are a few in the in Southern Maryland that do have some of the things that you may be able to get if nobody else has it. I would take that shot. But I will tell you, masks are going to be very important. We're the new normal. This is the new normal. We're going to have masks for a while. I'm in the fire department in Huntingtown, and I mean, it's going to be the new normal. You know, it's what we see, it's what we're hearing. And so if you haven't actually purchased masks for your business, start researching them. They seem to be starting to stack up with a little bit more supply on the net now. If one of your local resources don't have them, but be proactive. You are going to need items to be able to open. If you don't have the items, you probably will not be able to open. So start investing in those items. You know, we looked at it in one way. If we buy too much of the stuff and we all of a sudden comes down and we don't need it anymore, then we'll go for the tax write-off and donate it to a nonprofit or something, if we bought too much of it. But we want to be able to open, and we feel like being proactive is the only way we're going to get the shot.
Thanks, Jeff. Before I go to Todd, Dr. Polsky, I wanted to ask you, everybody has been talking about utilizing hand sanitizer, and we actually got a question in the chat about hand sanitizer. Is there something that, like a consistency of hand sanitizer that business owners should be looking for that will kill the coronavirus?
As far as specific formulations, the EPA has a laundry list of cleaning products for different situations, and that's the best place to take a look. Depending on the cleaning agent, the concentration is also important. And so if I start listing out a lot of things, I'm probably going to leave a few things out, number one, and number two, it's going to get confusing as far as all these percentages. So just go on the EPA website, it's just epa.gov, and take a look there, and it should list everything for you.
Thank you, Dr. Polsky.
Dr. Polsky, I got a question for that along those lines, because we are getting a lot of hand sanitizer in. We've looked at the guidelines, but a lot of people still have that mentality: no alcohol, no good. Is that truly the case?
So it doesn't have to be a specific. If I understood your question right, would alcohol be a disqualifier? No, it's fine. Alcohol sometimes is more of a drying agent, so that's the only thing. In the summer, probably not as much of an issue. As someone who used to do surgery and scrub my hands all the time, I know that during the winter time, I would start getting little cuts in my hands just from all the washing. So it could be more of an issue with those formulations as we hit into next winter. But right now, as far as disinfection, it's fine. And I think for most people, as far as their skin, it would be okay as well.
Thank you, Dr. Polsky. Todd, I'll ask you real quick. For Chick-fil-A, what have you done to keep your customers and employees safe in recent weeks? And what have you learned? Todd, are you there?
Can you hear me?
Yes, go ahead.
I am here. You can hear me now? Okay.
Yes, thank you.
So well, I appreciate y'all allowing me to come on. So we kind of started doing some preventative stuff from the beginning. Some of the stuff that we're doing just from the standpoint of from customer facing is we kind of shut down a lot of the customer facing aspects of our business. Although we can have carry out in a restaurant, we have chosen from the beginning, we had gone to a touchless restaurant, so we don't allow guests into the restaurant at all. We've created a curbside. Luckily, you know, a lot of our business is in the drive-throughs that continued. So we were fortunate. I know a lot of the businesses don't have that luxury. We had chosen to bring our team members in from our outside order points. We're doing a lot of using bus pans to be able to hand guests their food so that we're not actually coming in contact with them. Well, we require guests to use their own credit card swipes. So we have mobile credit card swipes. Have moved a lot of our points outside, like so our credit card machine for the drive-through actually sits out on the cart, so the guest actually doesn't come in contact with our team member. Some of the things that we do from the team member standpoint is that we've done from the beginning, even though it wasn't required for non-customer facing guests or team members, was we had from the beginning required every guest or every team member in our restaurant to actually wear a mask from the beginning. I know it wasn't comfortable. It was hot a lot of the times and team members didn't like it. But we had formulated from the beginning an actual action plan, came up with an actual specific COVID sort of guidelines in our restaurant, how we're going to approach it. We set up questions on our POS system that require them to actually answer them. And it talks about, have you had a fever? Have you had these symptoms, and so on and so forth. And it doesn't allow them to actually clock in until a leader actually swipes them in, answers the questions, and actually we take every team member's temperature with one of the infrared thermometers as soon as they come in and when they come back from break. We have also eliminated our front of the house, kind of excluded our front of the house, the back of the house. So we have them come in separate entrances, only have one entrance for the front of the house, have one entrance for the back of the house. In the event that we do have some sort of potential situation where a team member was to come in, to contract COVID, that we at least know that we're eliminating the exposure that they may have with other team members. We have a lot, because of the fact that we close our dining room, we have a lot of people sitting in the dining room taking orders out in the dining room. We've separated tables where they take breaks and they're like 5 or 10 feet away from each other. So we implemented a lot of things from the beginning to really keep our team members safe. And then have chosen, even though some of the restrictions, and even as the restrictions sort of have felt that they're going to get lifted to allow guests to come into our restaurant, we're probably going to be a little bit slower on that end to allow that to happen until we feel really safe, that our team is confident that they're safe, that they have the tools that they need to be able to do their job and be able to serve our guests. Something we also do is obviously with the hand, I cannot stress probably the hand washing enough. We actually have a timer that goes off at least every 30 minutes in a restaurant, and somebody goes around and makes everybody wash their hands, and they take turns so that we don't stop the flow of a restaurant. So we don't shut down the restaurant. So everybody goes one at a time, washes their hands and changes their gloves. And then anybody that's in contact with high touch points, so doors, light switches, handles, anything like that, goes around and actually we have sanitizer wipes and sanitizer spray that we use. We also, at the end of the night, use a heavier duty bio disinfectant that we use at the end of the night, that we spray before we close at the end of the night. And something that we've decided to do is actually have our store professionally disinfectant every week. So that's something we're on a rotation of, that we started. So that way it gives our team members confidence that they're being looked after, that we have a safe environment for us. I know it's unfortunately for us, it's slowed up some of the process as far as from the order point, because it takes a little bit longer in the drive-through or in the front counter or in the outside to be able to order and get their food. But in order for us to be able to keep our team members safe and their families safe, unfortunately, I think we just had to explain to our guests, hey, with the current situation, here's what we're doing. Here's how we're protecting our team members, how we're protecting you. And I think that most guests have understood that. I know some, I think like Ben said, you're going to have a few guests that are, that don't understand exactly why we're implementing these and think that I just want my chicken sandwich in 2 minutes, and understand that it may take a little bit longer now because we're keeping a safe environment for our team and for them. And I think a lot of people don't understand that a lot of the things that we're doing is to protect them as well.
Thanks, Todd. I agree. Patients are important right now. And I really actually love the tip that you shared about setting a timer to remind staff that they should be doing a disinfectant. That's a really great tip. Dr. Polsky, if you don't mind, before we lost you, I had asked a question, and I'm going to go back to that question real quick because you were not able to answer it. And it said, do you have the ability to test for prior exposure antibodies? What is the guidance?
So we don't, at the moment, we don't trust antibody testing. The FDA has now started to really take a critical look at what just became a proliferation of companies throwing antibody tests out. I know there was a study recently out of UCSF, which is like the Johns Hopkins of the West Coast. They looked at 12 different antibody tests. They found all of them were inaccurate to pretty significant degrees. So I would say at the moment, although there are doctors who are ordering them, I would not trust them to say that, you know, this staff member is now supposedly immune to getting reinfected, that there's just problems there. And so at the health department at the moment, we're not recommending until there is definitive proof that these tests are reliable.
Thank you. Another question is, do you know what the infection rate is for those who come in contact with an infected person?
I wish it was that easy. So we don't have really good data. It looks like the best estimate at this point is about 2.5 people per. So for every person gets infected, about 2, they'll transmit it to about 2.5 other people. But the reason we don't have really good numbers is that we're still not sure for people who don't develop symptoms how likely they are to transmit. And so I think this is one of those that we're trying to do science at pretty much light speed at this point. Usually when the public finds out about diseases or things we're used to, those have been researched for decades. We have only a couple months experience. So I realize there's some impatience. We should have a definitive answer. Again, the best estimate we can give right now is about 2.5 people per.
So we did have a question, and it's in industry specific, but I'm going to change the question to be more open to many industries. And that is, if we relax the opportunity to have outdoor things, like outdoor barber shops or outdoor restaurant seating, do you feel that relaxing those guidelines will help businesses to reopen?
So I will say that there's just practicalities to that. I can't imagine outdoor barbers in December. So I think what we're going to see is that as we go through the next few months and we see what happens during the summer months, my hope is that the weather helps us a bit and diminishes the transmission of a virus, but we don't know for certain. And then as we go into the fall, what sort of business climate we're going to be in at that point. You know, are schools going to reopen? How is that going to affect transmission through the community? There are just a lot of variables that we can't predict right now. In the meantime, there are going to be a lot of business owners who are going to come up with innovative ways to do things. Some of those will turn out to be really good and maybe adapted for the long term, and some of those are going to end up being maybe not so feasible. So it's intriguing as to what could be done outdoors. But I would say that for the majority of the people who are on the meeting right now, they probably can't take their inventory outside, and there are things out in the elements you can't control that would end up causing further issues.
Thank you, Dr. Polsky. I'm sorry.
Kathy, if you don't mind, I saw there was a question about using bleach as sanitizer, so that one I can give a quick and easy. Again, a lot of this you can find online, but make sure if you go online, you're finding reputable answers and not just going to whatever website. So for bleach, the formulation, the CDC recommendation is 1/3 cup of bleach per gallon of water. And the bleach solution has to stay in contact with the surface for over a minute. I like Ben's leaving one for 5. That really assures that things are okay. The other thing is that bleach solution is only good for 24 hours. So you can't make up a huge quantity once a week and then use it. Chemical reactions start happening and the bleach is no longer effective as a disinfectant after the 24-hour mark.
Thank you, Dr. Polsky. We actually have a panelist question. So I will start with Ben again, and then we'll go to Jeff and then to Todd. So what is the one COVID-related adjustment or change that you have implemented that you think will remain for normal operations a few years from now?
ACE kind of helped us out launching a national acehardware.com where we can offer curbside. Is it the most effective for us? No, but that's not going to go away. That's something I think a lot of customers are still going to want to do. I think we'd be crazy. I'm sure everyone's heard it to say we're going to go back to normal. I don't know what normal is going to be. We have to learn from this. And I think a lot of it's going to be the cleanliness of not just employees and stuff like that, but touch points in the store. Absolutely.
Thanks, Ben. Jeff, do you have anything? I know that you're not open right now, but are there things that you think that you will keep implementing even after we feel more safe?
Yeah, we are definitely, what you see as a lobby in hair salons is really going to probably shrink, and a lot of your online check-ins, your app capabilities are really going to change pretty drastically and pretty quick. We are changing our app capability that we can even notify a customer 5 minutes before their chair is ready, and then another 1 minute before their chair is ready, so they can wait in their own car in the parking lot. We're taking a really strong stand and have invested a tremendous amount of effort and dollars since this COVID-19 happened, when we shut our stores on March 19th. And I look that that's going to be one of the new norms is, there's going to be less people that want to stand shoulder to shoulder. If any guy's ever been in our salon on a back to school period, it's butt to butt inside the waiting room, waiting to get a haircut. And that's not going to happen anymore. I do expect, I already have number 24, another store that's in plans for construction. And I had to tell the landlord, buddy, we have to hold up. And the reason we have to hold up is I think our overall store designs in the future are going to change, and we're going to be required to have more distance between each individual chair from the starting point. And I think that's something that everybody's going to have to look at. Designs of stores, remodels, things like that, they will all change down the road based on the guidances we're dealing with now and how things change in the future. So those are probably the biggest takeaways that we're probably going to have and see long-term changes of our business.
Thank you. Do you have anything that you would like to share?
Yeah, I agree with Jeff that I think that the design, and that's something that Chick-fil-A is looking at as well. Obviously, having these large dining rooms, even if we've been looking at kind of a three-phase from a standpoint of like, what do we do if we go back to just carry out? What do we do if we go to a partial opening? What do we do if we have a full opening? What does that look like? I think there's a lot of unknowns, so it's hard for us to kind of judge how that's going to look. And I think that's why we're being very, very patient and slow about having guests in there. So I think the one thing, like Ben said, is I think there's going to be a lot more curbside, trying to educate our guests. And we're looking how we're going to reconfigure our parking lot. And getting guests a lot more parking spaces to be able to stay outside the restaurant. At least we have the luxury right now trying to educate as many people as we can, because since we're not even allowing them in the restaurant, they're kind of being forced to say, well, if this is the product that I want, then I'm going to have to meet the standards of how they're serving the product. And I think that's going to be kind of a new norm. I'm not sure if our dining room is fully going to open up again. I know we have the kids' play place, which is just a challenge. We'll obviously, when we do open up, we'll have sanitizing stations built throughout the restaurant. But one of the things I think we'll also probably continue to implement is our weekly professional disinfecting. So we disinfect throughout the day, but I can't put a price on what it is to say to make my team safe by having a professional come in and actually do it and having it certified that it's disinfected for a whole week. It gives us a lot of confidence to not only my team and my guests to feel that this is a safe environment where they can actually come and work and do not have to worry about. It's one less thing they have to worry about. A lot of people have a lot of worries on their plates with homeschooling and what they're going to do in the fall and their jobs and things like that. We want to give them one less thing to worry about. So we're going, and I think, going to continue to do the professional disinfectants, and the curbside is going to be here to stay.
Thank you. So we're actually close on time. I'm going to launch one more quick poll, and then I'm going to have the last question to Dr. Polsky and any closing thoughts that he has. So I think you guys can all see my poll right now. We just want to know, what concerns do you have right now? And that kind of will help us to guide on some other types of topics that we can address in future webinars. So if you can just take a minute and vote for us, I would really appreciate it. And Dr. Polsky, while they're doing that, one of the last questions to address is there a formula to determine how many customers should be in the store at one time?
Wow, so that gets me in trouble at state. So we put out guidance, as Ben alluded to, back before the governor started closing businesses at a maximum of 5 people, and that includes both employees and customers per 1,000 square feet of retail space. So to put that in some perspective, in a 7-Eleven, Wawa, those types of businesses, that would allow about 25 people in there, which I think for almost all of us, we would agree would be plenty. 20 to 25, depends on the stores are slightly different in space. So we got that 5 out of 1,000, not out of something that we just sort of dreamed up, but that's actually the corporate recommendation for places like Walmart and the international conglomerate that owns Giant food stores and some others. They all had gone with the 5 per 1,000. And as we took a look at different retailers, we thought, well, that should give plenty of occupancy. And the reason that we wanted a limit, an actual hard number on there, is that if we ended up in a situation for whatever reason where there clearly were too many people, that we would have an objective standard to then take action and say, you know, to the manager, to the owner, that you need to change your policies and make sure that you can't have, you know, more. So I applaud Ben for saying that, you know, he felt at his business that that was probably beyond the number of people in his business that he thought was safe. But that would be an absolute maximum that we would recommend. Again, I will say that I've suffered a few slings and arrows from the state level about putting any kind of standard in place that is not going to be a statewide standard. So we'll see what comes out of the discussions of the Department of Commerce over the next week or two. Ultimately, anything that's made at the state level preempts what we do locally. And I think that's, I will close out unless Kathy, you have anything else for me to say, that it's really important for everybody to keep in mind that everything we're talking about today is going to be subject to change. We don't know how the virus will continue to propagate again through the summer and into the fall, and that may very well change things. And then, you know, there's always the human element that may shift things as well. So our job at the health department is to try to keep people as up to date as we possibly can. Just to realize that we may say one thing in early May or mid-May, and then we may say something that contradicts it in June because there are circumstances that we just could not foresee.
Thank you, Dr. Polsky. I appreciate your time today. Ben, Jeff, and Todd, we selected all 3 of you because we thought that you were doing a great job and role models in our community, and could help the people that were on the call today do some of the practices that you already have in place. Ben, are there any last words? And then I'll go to Jeff and Todd on things that you would like to share before we go.
No, first off, thank you guys so much. That truly means a lot. It's good to know that we're actually, it feels like someone actually thinks we're doing something good. No, we're in tough times. I will encourage anyone listening this, you know, when you get back, stay positive. That's something that, you know, I'm very big on, being positive for our staff. The mentality, it goes a long way on if we're going to be down about and negative about it, then it gets worse. It's a snowball effect. I'll give a shout out to Jeff. I know my wife would look at me when she asked who was on the call, and I said, the owner of Sports Clips. He's like, you know, this Corona thing, you got to get your hair cut. So she's screaming yes in another room. But no, I really do appreciate having us on this call. It's been good. And I will say, if there's any local businesses that want to try to get in contact with me, I'll talk to you guys and, work with you and give you some best practices or recommendations. I'm always here to try to help people in our community. That's for sure. Thank you, Ben. Jeff, any last words?
Yeah, I want to thank you guys for having us on here. This is very important, not only to, us that are on here, but to all the small businesses in the community. One thing I will give a little bit of advice. Small business is going to be under the microscope, and that's going to be making the right decisions, doing the right things, not only for your people, not the customer, for your people, because without employees, you don't have customers. Okay. And when it goes to this virus deal, I've always lived by the motto for years. I went through the car business when it crashed, and I was in that deal. When you get knocked down, sometimes you get up stronger. I truly believe if you live by that motto, we will get knocked down, but we will get up stronger. Everybody will come out of this better. I'm just like Ben. If anybody needs my contact information, feel free to reach out to anybody at the economic division, especially if you're in a hair salon aspect. And if you want to see the guidance that I sent to the state, I'll provide it to you. Any way I can help you. If you can't find the proper things, the mask and things like that, I'll try to help you in any way. I mean, I may own a bunch of sport clubs franchise, but I'm the local guy and I want to help every single one stay open. So if there's any way I can help you, please let me know. And Ben, don't feel bad. I told my girls that I was going to let this grow until we open back up. So we have to hurry up and open up. So I'm starting to look like you here. So I'll be all right.
Thanks, Jeff. I appreciate the humor. Todd, do you have any things that you'd like to share before we close today?
Jeff, I might be by too. My wife just walked in. She works at the restaurant and she's been bugging me about a haircut too. In fact, she's been looking at me, threatening to get the clippers out. So, but I'm not allowing that to happen. But I would encourage everybody to two things. One, again, definitely stay positive throughout this. One thing that we did that helped big time was obviously don't be rushed to just get open. Make sure that you have a plan about how you're going to activate your business. Communicate it to your team, know exactly how that they understand how it's going to be done, so that they can communicate that to the guests. Because one thing that we did was made sure that we had like a plan set in place. We had a written plan, made sure everybody went over it, make sure they understood it, and then we go over it over and over and over and over and over and over again. I don't think that there can be too much over communication about that. And we've just been making sure that we love on our team. So I come in, it's a challenging time for everybody. My biggest concern was not specifically me, is how I can keep my team employed. We have over 100 people on staff at my restaurant. So trying to keep that many people open, or employed is at times keeps me up at night. But we have been fortunate to be able to stay open. And I think a lot of the reason why people are still coming here is because they realize of the safety precautions that we're putting in place, and they can trust us. So if you have any questions, you can feel free. I'd be more than happy to kind of go over some of the things that we're doing as well, just like the other gentleman. You can always reach out to me. Kathy or Danita can give out my phone number. I have no problem, sitting down and having a conversation, talking about some best practices. But it's challenging. So I think everybody's in this together. We're all small business owners. I live right here in the community and stuff like that. So, I mean, I love my community and I want the best for every business in my community. So you can reach out to me anytime you want.
Thank you. So I just launched our last poll, and the reason why I did this was just to remind you guys that all of the questions that we have not answered today or didn't get a chance to, the hour has gone by very quickly. We will answer them and email you. So if you would like to put any other questions that you would like answered personally, we will ensure that they are answered. And we appreciate everybody that came today. And for our panelists, if you see in the chat, people have given a lot of kudos to you. We appreciate you coming on today. Dr. Polsky, we appreciate your time. We know that you're very busy. So thank you for spending over an hour with us today. And thank you for everybody who joined our webinar. I hope everybody has a great day.
And you will be getting a survey when I end this webinar. So please complete that and give us ideas about other topics you're interested in. Thanks so much to everyone.
Thank you all. I look at this as a true partnership. Again, it's really important to us that everybody out there can start getting an income coming in. That's incredibly important for people's health. And I think it's just great that all of you are taking the health of your employees and your customers as seriously as you can. So I will continue to partner with anyone and everyone. If people have questions, they're welcome to contact us at the health department. Thanks.
Thank you.